What are the top 3 illnesses you would treat?
I would say they're illnesses as such, but
It could be depression.
it could be anything from depression and anxiety, addictions. We get a lot of that as well.
Really?
Yeah, eating disorders because they're all actually,
Is that mental?
well, it's related to trauma. Yeah, never about food and it's never about the drug. It's about the pain that the person was in. So anything like that we can really assist with because we're resolving that wound.
Well, so basically depression, anxiety, eating disorders,
Yeah. Addiction.
drug addiction.
Yeah. So we work alongside them going into like a rehab, for example.
Yes.
When I was in clinic, we had a lot of people getting outpatient care. So they'd stay in the facility and then come out and get their sessions. So we'd work together. But again, that was them choosing to do that as part of their own care.
And how do you treat them? Like, what? So they come to you, obviously they're addicted to drugs or
Yeah.
eating disorders.
Yeah.
How do you treat them and how many treatments would it take to go, okay, the issue was potentially not resolved, but a lot better than it was?
Everyone's different because everyone's gone through different things as well. So it's to the what's the extent of it? But I would say within 3 sessions, people notice a shift, and that shift gives them enough to want to at least have capacity and space to work through other stuff as well. Because that's really what it is. Their cup's just full, and they're in so much pain. So if, for example, you're addicted to opioids, you don't want to feel anything.
Yes.
If you are, for example, having an eating disorder, there's something where you want to punish yourself, so you stop food. You don't need a dietitian telling you that you need to eat more.
So you're almost counselling people.
Counselling people, but not through words, not through talk therapy. You're almost counselling them through the actual body itself.
But when you did the treatment on me, you were talking.
Yeah, I was. Yeah. So I do that with everyone.
Okay. But you recognise the issue and then you talk them through the issue.
Yeah.
And then they release it themselves.
Correct. With my assistance. So sometimes I won't talk as much. Other times I talk more. The talking as well in itself changes the body's expression of it. So that's also how I know I'm right. Like I'm on the right, I guess, target. Because when I start talking about it, the body starts to feel different and I start to see a change in your face as well. Also, when you close your eyes, you start rapid eye moving, which is how when we sleep, we're in rapid eye movement state. So it's changing your state of consciousness. So in that state of consciousness, we're shifting the unconscious, I believe. Because consciously, what I said, you might already know, but that's not enough. That's why talk therapy is not always enough. You're working with the conscious. So this is almost unconscious counselling, so to speak, combined with a bit of conscious.